The Lagos State government has adopted the One Health strategy to combat the recent cholera outbreak. At a press briefing on Tuesday, Commissioner for Health, and that's Professor Akin Abayomi, detailed the collaborative approach, which involves various government entities working together. These include the Ministries of Health, Environment, Agriculture, Fiscal Planning, and Education, among others, all aiming to prevent and control the disease's spread in Lagos communities. The commissioner said the collaboration marks a significant step in the fight against cholera, reinforcing a government's commitment to safeguarding the health and well-being of its residents. He also assured the public that the outbreak is under control thanks to an incident command structure led by Governor Babajide Sanwo-Olu and an effective emergency operations center. The center includes multiple pillars representing different ministries, agencies, and relevant stakeholders. And now to look more into the surge in cholera outbreak cases in Nigeria and the measures taken by the Lagos State government. I'm joined by a medical expert and CEO, Dr. Nesochi LLC, and that's Dr. Nesochi Okeke-Igbokwe. She joins me live via video chat. A very good morning to you, and thank you so much for joining us. We're pressed for time, so let's just get started very quickly. Let me start by asking, what are the typical symptoms and signs of cholera, and how does it even spread within communities?
So we have to first understand what cholera is. Cholera is an infectious disease that is caused by bacteria called Vibrio cholera. Symptoms that everyone should be aware of is very watery, profuse diarrhea, what we call rice water looking stools, extreme issues with vomiting, issues with nausea. These are all severe gastrointestinal symptoms, and the loss of fluids that one can have through the issues with the vomiting and especially the diarrhea can cause severe dehydration. The concern is when one has this severe dehydration, that can translate into complications such as kidney failure, shock, coma, and the worst case scenario, death.
Right. Now, what individuals do you think is at risk, when in reducing the risk of infection, I beg your pardon, what can individuals do?
Yeah. So individuals who are exposed to contaminated water, poor sanitation, have inadequate hygiene, those are the individuals that are at greater risk. And you have to understand how this disease actually even spreads. The cholera bacteria is passed through feces. So it's spread by eating or drinking contaminated water or contaminated food that has the feces of an infected person in that sample. So with that said, things that need to be done at this time is really prevention in the form of focusing on hand hygiene. We need to ensure that everyone is washing their hands with soap and water before eating food, before preparing food, especially after using the bathroom. You also have to try to avoid water that has not been properly treated. Those basic preventive measures can help to stop the spread of cholera. Other things that are necessary as well are vaccinations. Unfortunately, there is a lack of vaccinations and vaccines for cholera available here in Nigeria. So until we have that access to the vaccinations in tandem with just the hand hygiene and improving sanitation measures, there's really not much more but the hygiene piece that can be done to minimize the risk of exposure.
I'm so glad you're talking about, strategies and just how to prevent it, preventative care, which takes me to my next question, right? The minister, the commissioner for health for Lagos State have talked about the One Health strategy that is being adopted to sort of curb and, prevent more cases. But how effective do you think the strategy is, which is the One Health strategy? And how effective will it be in combating cholera outbreaks compared to other public health approaches that we've seen?
So ultimately the goal is to support the coordination of the response to cholera across the country, especially in the hotspots around the country. But overall, the main thing that needs to be done is strengthening the healthcare infrastructure of Nigeria. There's a lot of inequity when it comes to healthcare in this country. Every Nigerian should be able to have access to healthcare. And I think that's the underlying issue, because there are treatment modalities available for one who is grappling and dealing with cholera, but do they have the access to get the necessary treatment? I think from a government point of view, if we do not strengthen and fortify the access issue that a lot of Nigerians have, then that's when we're going to continue to see more and more problems with the treatment of cholera, the access to the oral hydration solution that is the mainstay treatment with one that is infected, with IV fluids. How does the average Nigerian who potentially can be infected with cholera gain access to treatment so that they can actually survive when exposed?
Well, Nesochi, let's now talk about, basically, I'm glad you're bringing this up because the torrential rains are back, right? And just yesterday, one of the major parts of Lagos State was flooded. And somehow, I can link the two, cholera and contaminated water and flooding, right? Because it pushes out the feces from all the drains and the gutters and back up, and it can now filter into our drinking water or even the water systems, right? So if I'm in Lagos and I'm watching, or any part of the country watching, what advice do you have, for us or for the public in general, my viewers watching, to protect themselves from cholera and contribute to preventing its spread?
Essentially, you have to be aware of the water sources that you are exposed to. And that's the key at this time. Contaminated water sources really will translate into problems with potential exposure to cholera. So make sure the water that you're using to prepare food or the water that you're drinking is treated, is bottled, is a clean source of water so that it does not impact one negatively.
Dr. Nesochi Okeke-Igbokwe, that's my guest. Thank you so much for coming. I appreciate you for doing this with us.